So in this episode, let's talk about strikes, specifically nursing strikes. So over the years, ever since I started nursing back in 2016, 2017, you never really heard about strikes, especially in the nursing field. I know maybe you would drive by a busy street and you would see that giant rat. Here in Illinois, there's like a giant rat that people inflate that are striking. Lots of people that are in the trades industry, the plumbers, electricians. Even I've seen a couple schools strike back in the day. And even recently, especially like the union workers, especially the people that are, like I mentioned, in trades, electricians, plumbers, all that kind of stuff, they always set up like a inflatable rat and they protest by that. But come back to nursing is, over the years, I haven't really noticed a lot of nursing strikes. I feel like this is something that has been much more common these last, I want to say, 2 to 3 years, especially after the whole widespread infection that was going on. I feel like strikes are definitely on the rise because people are starting to realize that these working conditions aren't the best, and they haven't been really good conditions for a really long time. Not in the sense where it is, I want to say, physical safety. I do understand that lots of nurses do get hurt on the job, a lot of back problems, a lot of issues dealing with mobility, things like that. But nursing is a little bit different when it comes to safety because you don't really have things falling on you. You're not getting shocked by anything. You're not using drills, tools, heavy lifting equipment, except, of course, for your patients. Nursing safety, when it comes to nursing safety, it's more about safety in the sense of the safety of others and your license, meaning that as nurses, we have our nursing license, and if we do make a mistake, or if we have unsafe conditions that lead us to making mistakes, then our license is in jeopardy. We could lose our job, lose our careers, and we could be permanently banned from the whole nursing healthcare field. So imagine you going to school for 4+ years, getting your bachelor's, becoming a nurse, and you start working in a hospital. Ratios aren't the best. Everyone's stressed out, and you're super stressed out. Maybe you've been working in not ideal conditions, but you're just doing the grunt work. You're the grunt of the team. You're just like, take it on. I got to do what I got to do. We're nurses. We have a lot of empathy. We want to do the best that we can with what we have. And sometimes that leads us to a little bit of a trouble in the sense of safety because the people that we work with, the places that we work for, don't always give us the right environment for success. So if you're super stressed out, you're not supported, you're more prone to making mistakes. The less of a good condition you are working in, the more prone you are to making mistakes. And if you're in this unsafe environment, you make a mistake, you lose your license. Lots of the times, the hospitals don't really want to get your back. We've heard about all these cases where on the news, nurses have made mistakes and they got no hospital backing because it put their hospital in a bad light. So the hospital is kind of like, in a way, they're like, screw you, deal with it on your own. We're not gonna back you up because this gives us a bad name in a sense. Almost like they feel like they aren't doing a benefit for the community. So nurses being nurses, we are fairly disposable in a sense. I know there's a lot of shortages, but still, we are bachelor degree people. So if you think about it, we are more replaceable than certain people like physicians. There are other job roles or places that are less fillable in a sense. So you're always going to be disposable as a nurse in a sense, even during a shortage, because we do take the burden of hospital costs. But back to the point of the argument is that lots of times the hospitals expect you to work in these conditions. They expect you to be quiet. They expect you to just work through it, figure it out, not say anything. And then at the end of the day, they'll fire you. They'll let you go. If you want to leave, go ahead and leave. We're not going to try to maybe better the conditions for you so you can stay. They don't really care. They'll throw you under the bus if they have to, unfortunately, because that's just an environment we work in. It's not the best environment, but in a sense, it is a little cutthroat. You could say nursing is the wash of healthcare in a way.